of specimens safely. For the healthcare provider, we would be called as a healthcare provider, collecting specimen or working within the 6 feet of the patient suspect to be infected with the SARS-CoV-2. This is the name of virus. So as we all are aware about that, the infected person, we should be away at least for 6 feet. But for the collection of the swab, we will have to go nearby the patient. So if we are working within the 6 feet of the suspected infected from the coronavirus patient, so maintain proper infectious control and use recommended personal protective equipment. What is called as personal protective equipment is nothing but your N95 mask and face shield. It would be there. Then hairnet, gloves, eye protection, and gown. You might have seen in some photographs and some video how the gown and gloves and the eye protection goggles will look. N95 mask, definitely you all people are using in these days. For healthcare providers who are handling specimen but are not directly involved in collection, like the person who are handling the specimen but they are not into the collection of the swab, they are not working within the 6 feet of the patient, follow the standard precaution. The standard precaution is nothing but they should not touch directly to the sample. They should handle the sample from the outer bag. So such kind of precaution should be there. Healthcare provider should wear a form of source control face mask and all time while in the healthcare facility. Healthcare providers can minimize PPE use if patient collected their own specimen. There is another technique. If patient himself will collect their sample and give to you, so there would not be requirement of use of entire PPE, personal protective equipment. You can wear a minimum, like if you are wearing only the N95 mask or if you are wearing gloves, that's enough for you. Respiratory specimen collection. Respiratory specimen should be collected as soon as a decision has been made to test someone, regardless of the time of symptoms onset. The guidance below the address option for collecting specimen. So as soon as we'll get information like someone, we'll have to take a swab for someone. To collect the specimen, proper specimen collection is the most important step in the laboratory diagnosis of the infectious disease. A specimen that is not collected correctly may lead to the false or inconclusive test results. So definitely the test is all depends on how you are collecting the swab. If your swab collection is not proper, if the virus infection will not come into the swab, that it will go and it will give the false negative results. So it will be inconclusive. So the technique is more important for us, how we are collecting the swab. Okay, so after this guideline, I'm going to share you a video, YouTube video, where you will get a whole idea how to take a swab. So we'll have to contact the testing laboratory to confirm accepted specimen type and follow the manufacturer instruction for specimen collection. You would be having a manufacturer, you will have to have one swab stick and the viral growth media inside the tube, and you will be having a manufacturer instruction how to use this viral media as well as swab. 1 minute. So you will have to follow that manufacturer instruction. Sterile swab should be used for collection of upper respiratory specimen. The swab, what you are using, it should be sterile. It should be packed. You will have to open from the pack and you will have to use this. This is important both to ensure patient safety and preserve specimen integrity. As while taking the swab, we will have to ensure that there should be the patient safety, as well as what specimen you are taking. That integrity is more important. If there would be any external contamination or any external thing which will interfere the viral growth or stability of that virus inside the tube, it will give you the false negative or false positive result. So we will have to take care while handling such kind of swab and the sample. And so this we'll have to first consider the nasopharyngeal swab and oropharyngeal swab specimen are not appropriate for the self collection. First of all, if people are asking, they will take their own swab, so it may not be correct. Definitely, high chance are there it would be the false negative. Why? Because if people will take their own swab, due to that irritation, if they insert the swab inside their nasal tract, he will feel some irritation kind of thing, or he may not take swab properly. So self collection is need to be avoided. So the sampler need to go near the patient and he has to collect the swab for that. Testing lower respiratory tract specimen is also an option. Lower respiratory tract is nothing but from our mouth, and upper respiratory is from our nasal tract. For patient who develop protective cough, sputum can be collected and tested for the coronavirus when available. If the cough or sputum would be there, that also can be collected. If person is giving it out, we can collect and we can test directly. It is also a method to test. However, induction of sputum is not recommended due to the possibility of aerosol production during the procedure. Okay, because once it will come out in the environment, there may have some kind of aerosol contamination may be there in that, so it is not appropriate. Under certain clinical circumstances, that can be done. And you can see that upper respiratory tract, as shown in the photograph, how the swab need to be inserted here. Use only synthetic fiber swab with thin plastic or wire shaft that have been designed for sampling the nasopharyngeal mucosa. Do not use calcium alginate swab or swab with the wooden shaft, as they may contain substance that inactive some virus and may inhibit molecular test. As guideline shows that we will have to use the plastic shaft swab. If you are using any other calcium alginate or any wooden shaft, the MOC, material of construction of that swab, may interfere the result. It may decontaminate the virus in the swab if it will come in the contact with that. So to avoid these all issues, we will have to use a plastic swab. CDC recommend collecting only the NP specimen. NP is nothing but the nasopharyngeal specimen from the nose. Okay, although on the OP means oral specimen is an acceptable specimen also. If both NP and OP specimen are collected, combine them in a single tube to maximize the test sensitivity and limit use for the testing resources. If NP and OP both we are collecting, we will have to mix both the swab in a common tubes. Hope you all are understanding. Is it clear to all? Okay.
Yeah.
Yes.
Yes.
Yeah.
For collecting of NP specimen performing by a trained healthcare provider. Tilt patient neck like head by 70 degree. This I'm going to show in the video also. And as Gaurav has told that you are already having the video. So later on after that training, you should go through the video and the guideline. Gently, slowly insert a mini tube swab with a flexible shaft. The shaft of the plastic shaft is very flexible through the nostril parallel to the palate, not upward. We should not take the swab upward. Okay. Until resistance is encountered or distance is equivalent to that from the ear to the nostril of the patient, indicating contact with the nasopharyngeal. Gently rub or roll the swab. We will have to either rub or we'll gently roll the swab. We should not move upward or downward the swab because it may hurt the patient, because inside the nostril the skin is very sensitive and it may hurt to the patient. So gently we have to rub. Leave swab in a place for several seconds to absorb the secretions. So if there would be the viral secretion inside, let it absorb to the swab. Slowly remove swab while rotating it. We'll have to keep rotate on their axis and we'll have to remove directly from out. The specimen can be collected from both sides using the swab, but it is not necessary to collect a specimen from both sides if the mini tube is saturated with the fluid from the first collection. Okay. If a deviated one minute. Okay. If deviated septum or blockage create difficulty in obtaining the specimen from one nostril, use the same swab to obtain the specimen from the another nostril. So we used to observe that sometimes people is having difficulty or blockage in a one nostril. If a patient will complain that this nostril is blocked or it is not open, the same swab we should insert to the another nostril. Place swab tip first into the transport tube provided. Instruction for collection of OP. Since we are going to take from the NP, so we'll go ahead for this. OP is also the same, but it will explain in the video also. Insert the swab in all. Okay. Nasal mid tubin specimen. This is the same viral guide. Okay, so interior nasal specimen, like inside the nasal cavity, how to insert and how to collect the swab. Insert the entire collection tip. The collection tip is nothing but a swab tip. The swab provided usually half to 3/4 of inches or 1 to 1.5 centimeter inside the nostril. We'll have to insert that part inside the nasal cavity. Formally sample the nasal wall by rotating the swab. in circular path against the nasal wall at least 4 times. We'll have to rotate it 4 times. Take approximately 50 seconds to collect the specimen. We'll have to keep the swab inside for the 15 seconds for the appropriate absorption of the fluid in the swab. Be sure to collect any nasal drainage that may be present in the swab. If there would be any fluid, any drainage would be there, so we will have to collect that. Repeat in the other nostril using the same swab. Place swab tip first into the transport tube provided. There would be one transport tube which is containing the viral growth media. We will have to dip that swab tip first into that tube. That is okay. It is again testing and all procedure. This is wash and all. This is lower respiratory tract. This is how to order swab and media, which may not be relevant to us because we will be having, the government will provide us entire kit and all. Okay, so should we go to the video presentation? Do you have any question in that?
Manish sir, I request you to cover the entire topic and then we can welcome more questions.
Okay.
So this way that everybody will able to get a glimpse of what we are trying to accomplish here.
Because some of the things are related to testing and how we are ordering that need to be covered, Gaurav?
Yes.
Okay.
Basically, we want to give an overview that so that if let's say I'm going for an interview, I should say I'm aware of the CDC guidance document, plus I know how swab samplings are done. So that's how one should answer, and that is the objective of this session. So we should deliver that.
So the next technique is nasophageal wash or aspirate or nasophageal wash. Like this is another technique. It's alternative of the swab. Like we will take fluid from their nasal cavity out using some saline from their nasal wash. What we can say that. So first of all, we'll have to attach the catheter to the suction apparatus. Suction apparatus is nothing but we'll suck that nasal fluid in the tube till the patient's head back to the 70 degree. Still 1 ml, 1.5 ml of non-bacteriostatic saline. Non-bacteriostatic saline means it is sterile. The pH would be 7 into one nostril. Insert the tubing into the nostril parallel to the palate, not upward. Parallel to the palate, not upward, as I explained you in the swab. Catheter should reach depth equal to the distance from the nostril to the outer opening of ear. That the distance should be covered, as I shown you there in the one photographs. You can see here. The depth should be that the same. Catheter need to be inserted up to that depth. Okay. Begin gentle suction, aspiration, and remove catheter while rotating it gently. Place specimen in a sterile viral transport media. This is the alternative technique if we are not using swab, we will have to use with catheter with the suction tube. For additional visual guidance, see that this attachment we can see for the additional guidance. Now this is saliva collected by the patient with or without using the supervision. Collect 1 to 5 ml of saliva in a sterile leak-proof screw cap container. There would be sterile leak-proof screw cap container. There we'll have to collect 1 to 5 ml of patient saliva. No preservative is required. Follow additional instruction for the healthcare provider or manufacturer. This is a simple 1 to 5 ml saliva we'll have to collect in a leak-proof screw cap container, and we need to provide to the laboratory for the testing. Lower respiratory tract. Okay. So for the how we'll correct from the lower respiratory, as I shown, the lower respiratory tract is nothing but from our mouth and it is generally performed by a physician. It is not for a trained swab collector. It need a different technique to collect from their lungs and from their bronchoalveolar lavage. So it is performed generally by the physician only. So that also will go through, collect 2 to 3 ml into the sterile leak-proof screw cap, sputum collection cap or sterile dry container. Due to the increased technical skill and equipment need, collection of a specimen other than the sputum from the lower respiratory tract may be limited to the patient presenting with more severe disease, including people admitted to the hospital or fatal cases. In these cases, only this kind of swab will they may get collect the swab, because in some of the cases, if infection of coronavirus will go inside the lungs, then nasal cavity or buccal cavity swab may not be appropriate to identify the coronavirus, because the infection will reach to the lungs. So there would be the different technique for the collection of this swab, this kind of specimen. Sputum collected under the guidance of trained healthcare professional for a patient who developed the productive cough. Sputum can collect and tested when available for this coronavirus. However, the induction of sputum is not recommended. Educate the patient about the difference between sputum and a deep cough or oral secretion, with saliva, spit. Have the patient rinse the mouth with water and then expectorate deep cough sputum directly into the sterile leak-proof screw cap collection cup or sterile dry container. The small note is this is an aerosol generator procedure and likely to generate the higher concentration of infectious respiratory aerosol. Aerosol generating procedure potentially put healthcare provider and other at an increased risk of pathogen expose and infection. Healthcare providers should maintain proper infection control, including standard precaution and wear an N95 or equivalent higher level of respirator, eye protection glove, gown when it is collecting the specimen. So if we are handling such kind of sputum, cough sputum, we will have to be more cautious, more careful, because it generate the aerosol, and this would be the more contagious. So we will have to take a additional precaution while collecting or handling such kind of specimens. And this comes for the how to order swab and media. The US Department of Health and Human Services is directly managing allocation of some swabs and media, including viral transport media, based on state of and territory testing plans that were submitted in response to the coronavirus ad relief and economic. Including viral transport media based on the state territory testing plans that was submitted in response to the coronavirus ad relief and economic security act requirement. Allocation were predetermined to maximize state and territory testing using a data driven algorithm based on population, high incidence area, and COVID-19 task force directives. A monthly web-based survey goes out to each state and territory where they can request the number of swabs and media required. It is web-based survey, and we can request through that for the number of swabs and transport media. As of August 2021, HHS is distributing the following swabs. Let's say NP swab, I explained the NP swab, nasal form, and poly swab they are distributing. HHS is also distributing VTM for a specific swab or medium request, delivery site changes, or other related request. So we need to contact that given link. Public health and clinical laboratories can also produce their own VTM if it is unavailable for purchase. Okay. In response to VTM shortage, CDC posted a standard operating procedure for the preparation of VTM. Saline is also an acceptable transport medium for some coronavirus viral assay. So saline is nothing but you will get the saline 0.9% NaCl. Sodium chloride is nothing but saline. It should be sterile. That can also be used for the collection of specimen, including the influenza, SARS-CoV-2, flu, SC2, multiplex assay. Check the instruction for use, IFU, instruction for use, to see which transport medium is acceptable. We'll have to go through the instruction. We'll have to check which kind of transport media is suitable for which virus. That need to be checked. Assessing validity of specimen obtained through the self-collection. Self-collection of specimen, both unsupervised and supervised by a medical professional, is currently available for a specific test authorized by FDA. Additional authorized diagnostic test for the detection of SARS coronavirus 2 will likely have this capability as well. Laboratory should confirm the specimen has been obtained correctly and from the individual that is being tested. Generally, clinical laboratory improvement amendments requires laboratory to ensure positive specimen identification and optimum integrity of a patient specimen using at least two separate or a unique identifier, such as patient name or another unique identifier. Other information that must be provided to the laboratory when requesting a test includes the sex and age or date of birth of patient, the test to be performed. So that basic information need to be collected, the specimen source, date, and if appropriate, the time of the specimen collected. So these all information need to be provided. Handling bulk package trial swabs properly for upper respiratory specimen collection. Sterile swab for upper respiratory specimen collection may be packed at two different ways: individually wrapped or bulk package. So the swab what we are collecting, how we are going to collect the swab, there is two different way for the packaging. It will be either it will be individual wrapped, preferred when possible. So if it is individual, if it is possible, then we'll have to prefer this, or otherwise bulk package. When individual wrapped swab are not available, bulk package swab may be used for specimen collection. However, care must be exercised to avoid this virus contamination of any of the swab in a bulk package container. The risk is that if you are packing a lot of swabs in a one packet, there may have chance for the cross contamination. One swab contamination will go to the another swab, or it may give the false results. Before engaging with the patient and while wearing a clean set of protective gloves, distribute individual swab from the bulk container into individual sterile disposal plastic bag. If bulk packed swab cannot be individually packed, use only fresh, clean gloves to retrieve a single new swab from the bulk container. Close the bulk swab container after each swab removal and leave it closed when not in use to avoid the accidental contamination. As soon as we'll have to open and immediately we'll have to close. It should not be remained open for a longer time. Store open packages in a closed airtight container to minimize the contamination. Keep all used swab away from the bulk swab container to avoid contamination. As with all swabs, only grasp grabs the swab by the distal end of the swab using glove hand only. We'll have to use the glove hand to touch the swab. When patients are self-collecting the swab under the clinical supervision, hand a swab to the patient only while wearing a clean set of protective gloves. The patient can then self-swab and place the swab in transport media or sterile transport device, and it should be sealed. If the patient need assistance, you can help the patient place the swab into the transport media or transport device and seal it. If he is not able to do that, we'll have to help them. Storing and shipping the respiratory specimen. Store respiratory specimen at 2 to 8 degree. The respiratory specimen, as soon as we'll collect, we'll have to keep under the cooling. The specific temperature is 2 to 8 degrees centigrade for up to 72 hours after collection. If a delay in testing or shipping is expected, store specimen at minus 70 degree. If the specimen will get tested within the 72 hours, then we'll have to keep the specimen in a 2 to 8 degree. If the test will take longer period, it will go beyond the 72 hours, then we'll have to store these all specimen to the minus 70 degree or below. It may be the cryopreservation. Store extracted nucleic acid sample at the minus 70 or lower. Pack and ship suspect and confirm coronavirus patient specimen, culture or isolate as UN 3373 biological substance, category B. This is all technical. In accordance with the current edition of International Air Transport Association Dangerous Good Regulation and US Department of Transportation Transporting Infectious Substance Safety. These all are the guidance, the norms. Personnel must be trained to pack and ship according to the regulations and in a manner that correspond to their functions, specific responsibilities. Additional information on packing, shipping, and transporting specimen can be found, if anything, through this interim laboratory biosafety guideline, handling and processing a specimen associated with the coronavirus, shipping a specimen to the CDC. If necessary, and with advance approval, specimen may be shipped to CDC if repeated testing results remain inconclusive or if other unusual results are obtained. Please contact CDC at virus at this is the mail ID they have given. We'll have to contact them prior to submitting the specimen to confirm. Additional information including the specimen submission form and shipping address can be found. Later on, you can go through all that additional information to get a more insight. And this is for the pneumatic tube transport. CDC recommends that each laboratory perform a risk assessment before using the pneumatic tube system to transport the suspect or confirmed virus specimen. Each facility should conduct a site and active specific risk assessment of the procedure performed, identifying the hazards involved in the process. The competency level of the personnel performing the method and the laboratory facility and institutes biosafety professional laboratory management, scientific, clinical, and safety staff should be involved in conducting the risk assessment process to determine the approach specimen transport practice to implement at the facility. In a nutshell, they wanted to tell while the transport of the specimen, there may have some lot of other circumstances or a lot of other situation which may cross contaminate the swab, which may inactive the virus, which may interfere anything which may alter the final result. There may be the false positive, false negative results. So during the transportation, we will have to assess the risk, what may go wrong while transportation of this specimen, by which the result may vary or result may alter. So that need to be done. Facilities should ensure that all personnel who transport specimen via pneumatic tubes are trained in safe handling practices, specimen management, and spill decontamination procedure. Capillary finger stick specimen collection. Blood specimens are used for antibody or serological test. For some tests authorized by the US Food and Drug Administration, data are used at the point of care. Specimens are collected by the pricking the skin with a finger stick device. Anyone performing finger stick procedure should review the following recommendations to ensure that they are not placing person in their care at risk for the infection. Finger stick device should never be used for more than one person due to the risk of transmission of other blood-borne infectious disease. It is all self-explanatory. These recommendations apply not only the healthcare facilities but also to any setting where finger stick procedure are performed. So these are the instruction for collecting a capillary blood specimen by finger stick. Wash your hand with warm soapy water and dry through or perform hand hygiene using alcohol-based hand sanitizer. We have to sanitize our hand. Put the gloves for the collection of the finger stick blood specimen. Hold the hand of the person being tested in downward position and massage the hand to improve blood flow into the finger. So improve the blood flow into the finger, we'll have to little bit massage. Use the middle ring finger for the specimen collection. Locate the puncture site. It should be slightly off center, lateral side. It should be off center, lateral side, down side of the fishy part of the fingertip. Clean the puncture site with the 70% isopropyl alcohol. It is we'll have to take the soaked. We have to soak cotton in a 70% IP, and we'll have to rub on the fingertip. Allow it to dry. Use the manufacturer product collection device or disposable single-use lancet that retracts upon the puncture for performing the finger stick. Follow the manufacturer instruction if using their collection device. Press the finger stick collection device or lancet firmly against side of the finger pad and active to perform the puncture. If using the lancet, make a single puncture in one smooth motion. Gently squeeze the base of finger to form a drop of blood at the puncture site. Avoid squeezing the finger repeatedly or too tightly. Wipe away the first drop of blood and follow manufacturer instruction to fill the capillary collection tube or apply the second drop of blood to the test device. Dispose of used finger stick collection device and lancet immediately at the point of use in an approved sharp container. Never reuse it. We'll have to dispose it in a hazardous waste in a specific sharp container. Apply firm pressure to the puncture site with clean gauze for 5 to 10 seconds after collecting the specimen to ensure bleeding has stopped. If needed, apply self-adhering latex-free adhesive strip to the site. So the blood bleeding should stop. You'll have to ensure that. If it is not, then we can apply the self-adhesive latex-free adhesive strip to stop the blood. Properly remove gloves and discard in an appropriate receptacle. Okay, change gloves between contact with the each person being tested. That is important. We'll have to change the gloves from one patient to another patient to avoid any kind of cross contamination. Okay. Wash and dry your hand thoroughly and perform hand hygiene immediately after removal the gloves and before touching the medical supplies intended for the use of other person. So these are the general guidance in that majorly they have given instruction for the collection of swab and alternative from the nasal wash from the saline they have mentioned. So these are the different type of techniques. Then They have given guidance for the collection of blood in the capillary also that we explained. Now I am taking you to the video. You will have to watch this video carefully. Okay. Now are you able to watch this video in my shared screen? Okay.
Sir, we can go through the video.
Okay, fine. Diagnostic performing a nozzle. First of all, we'll have to wear all the control measures as shown in the photographs: the hairnet, goggle, N95 mask, gloves, and the gown. Respiratory mask, gown, goggle.
Sir, can I add, can you pause the screen? I want to add something to everybody. So team, as your resume will be getting submitted for interview, and let's say you are sitting with the hiring manager. Hiring manager will ask you a question, tell me your experience, share your experience that why you are a good candidate for this role. So you need to say, I have a fair amount of understanding that in order to execute this job, we need a hairnet, we need a goggle, we need N95 mask, we need a gown, and we need hand gloves. So these are few things you need to tell the manager that I'm aware of these personal hygiene, personal protective accessories to perform the task. Sir, we can proceed further.
Yeah.
Yeah, and these are the few examples that how hand gloves will be available, how goggles will be available, how gowns will be provided to you. These all are the accessories which you will be provided before you execute the responsibility, and you will be given these by the side when you go there. You need to cover yourself in the entire body, then add your N95 mask, your hairnet, and then you need to perform the um, nasal swab. So now I let Mani sir speak because he has an expertise on the swabbing procedure. Thank you, sir.
Yeah. So this slide, video slide is showing. So the beginning, what need to be done as we explained in the guideline that the head should be tilted up to 70 degree of the patient. It will explain. The patient should be alert and cooperative. Allow them to first blow their nose. So first, let them allow to blow their nose if anything would be there to avoid any kind of irritation. Let him feel very comfortable. Okay. Should be relaxed and comfortable position during the swab collection. Till the patient's head back slightly and support with the non-dominant. Lean the patient head against the near jerky movement. valve to minimize the jerky movement. Stand slightly offset from the patient to avoid the risk of contamination in case of sudden cough or sneeze. We will have to maintain a proper distance also. The patient knows they are welcome to close their eye. Sample collection should only be completed using the sterile swab made from the artificial cotton with a flexible plastic shaft. Calcium alginate swab or swab with wooden shaft must not be used. This material can interfere in your test. Inactive, it may inactive your viral particles or inhibit the PCR test. Furthermore, wooden shaft are more this one. It has the tendency likely to cause the patient's injury. So how to hold the swab? This is the technique for the holding of the swab. Hold the swab likely like we hold the pen between the thumb, index, and middle finger. Maintain. We'll have to hold it is loosely, not very tightly. Grip and allow the swab to accommodate any resistance encountered during the sample collection. So we know that how much swab we'll have to insert inside the nostril. So that distance should be there. We'll have to leave that distance, and we'll have to hold the swab from the back side. So we should not use this technique while holding the swab. We should not block the bottom tip of the swab. We should not otherwise it may injured person. Like if you are inserting the swab inside the nasal tract, due to the irritation, person may shake their hand, or due to the jerk, the patient may get injured. So the swab we should hold in our hand, not very like tightly, the very smooth and loosely we'll have to hold. And the bottom part of the swab should not be covered like this. Otherwise, swab movement will block and it may injure the person's nostril. Start by inserting the swab horizontally into the left or right nostril carefully. And carefully advise the swab while maintaining a course parallel to the palate, as I already explained in that guideline, as shown in the photograph. That much we'll have to insert the swab. It is approximately 5 to 6 centimeters or 2 inches. We'll have to insert. There is a depth or equal to the half of the distance between the nostril and outer opening of ear. We'll have to leave the swab for a few seconds for the absorbance of the fluid, and gently we should rotate that. And we have to put this swab stick into the transport media. And this is the technique by which we can collect the swab from the orophageal tract. Information that is smear. Ask the patient to open their mouth wide. We'll have to depress their patient's tongue using the tongue depressor and gently insert the swab in an oral cavity without touching the lips, teeth, tongue, hard palate. Surface should be avoided. They can offer colonized by the wide range of microbes because these all teeth and tongue would be having a different kind of microorganisms. If we'll touch that, swab may contaminate with the other microorganism and which can prevent further the growth of a virus. So there would be chance you will get a false negative result. So that is why it is advised directly to take a sample from this cavity, not to touch anywhere in the mouth. And we'll have to close this back in this manner. We'll have to put the viral transport tube in a bag. It is self-filling bag. And this is the complete collection technique. This is self. Gaurav, I think we have completed this other one. So this is the technique which I shown in a video, and I explained through the guideline how to collect the swab. Hope so you all understood. And Mr. Gaurav have already handed over you the guidance and the video. You can further go through it. It's a very simple technique. Oh, Gaurav, are you there?
Yes, Manish sir, hi team, everybody. So I recorded the content of this meeting as well. And as soon as we finish the meeting, I will share you the content. Content will come in like 30-40 minutes. So in the same email where we are communicating, I will share you the content as well. The purpose of this meeting was on Monday, we will submit your resume to COVID-19 swab testing site manager. Then somebody will reach out to you on phone. Make sure your phone voicemail is empty so that if somebody leave you a voicemail, you can hear their voice and reply to them to help schedule your interview with the manager. They will tell you where to come. It's in Raleigh, nearby your place, and then you go for an interview with your resume. The resume which you submitted to me, you can use that, or I will share you a link through which you can create your new resume as well. Make a printed copy and go to the interview. In the interview, you need to say, hi, my name is, let's say my name is Gaurav. My name is Gaurav. I am a XYZ graduate student. I studied this. I have previous experience in that. I'm really interested and I'm really looking forward to work in this industry. I'm really excited to be a part of this role if I'm given this opportunity. Let me give you a brief overview that what I know about this job. I know that there are 5 basic necessities we need to have in order to execute this job. For example, we need to have hairnet, we need to have a glass, eyeglasses, we need to have I-95 mask, we need to wear hand gloves, and we need to wear our gown. Then you tell them that I have reviewed and I have been trained on the CDC guidance document on how to manage the sample and how to take the swab sample from the individuals for the RT-PCR test. I am more than happy to learn your procedure and I'm a quick learner. I can execute these responsibilities on fast pace. Please give me this opportunity. And just for everybody, I will write this small message to everyone on the email as well. So you can read, mug up, prepare yourself before you go for the interview. Now, some of us may not get the positions because these are fast paced positions. and it is depend upon your interview performance as well. And none of us has the experience, but we are trying our luck. As a staffing, as a consulting company, we have so many other positions as well. So please do not dishearten if your interview don't go well, if you don't clear your interview, if something goes wrong, if you don't hear back from the manager. I will keep sending you other positions and I will keep applying you to other entry level role in biotech. Raleigh, North Carolina, as you all know, is a biotech hub. All manufacturing companies are there. You can make a space and an entry level role where you just need a high school. And if we need more training sessions, we'll schedule more sessions and you will receive some interview or meeting invitation from me. So I want to wish everybody good luck and I want everybody to keep an eye on their email. I want to keep everybody an eye on their voicemail, text message or phone call from any recruiter scheduling a telephone call or an on-site interview for this role. And soon or later, I'll share you the video recording of this training as well so that you can revisit the entire training session, prepare yourself well for this position. This is a great start. Everybody can get going into this industry. It's a high demand industry. Once you get the experience, you can work into other big diagnostic companies such as forget few names. There are very big names who are performing COVID-19 testing. So diagnostics labs can give you some other roles if you get some hand-on experience on such roles. Quest Diagnostic is one of them. So I want to wish everybody good luck. And I want to thank Manish sir for his valuable time and efforts in delivering and imparting this training to all of us. Thank you, everyone. Bye.
Bye-bye.
Thank you. Bye.